Marijuana refers to the dried leaves, flowers, stems, and seeds from the cannabis sativa or cannabis indica plant. The plant contains the mind-altering chemical THC as well as other similar compounds. Ever since the growing public acceptance of recreational marijuana use and the lack of a control system in Canada, the issue surrounding legalizing marijuana has received a lot of public and political attention in recent years. In the spring of 2017, the Liberal government announced that Canada would introduce legislation to begin the process of legalizing and regulating marijuana. Due to the ineffectiveness of the current system of prohibition in Canada, the issue surrounding legalizing and decriminalizing marijuana has attracted significant political and media attentions. Decriminalizing marijuana would mean that the personal use of the substance is still illegal and can lead to a small legal fine. However, it is no longer classified as a criminal offense. In terms of economic impacts, legalizing marijuana will increase tax revenues brought to the Canadian economy. High demand for recreational marijuana in Canada indicates that legalization of the drug would yield significant tax revenue. Additionally, the high demand for marijuana in Canada has resulted in the expansion of the black market and puts the power in the hands of illegal drug dealers to be the sole providers of the product. By taking control of the distribution of marijuana, legalization can reduce the black market for the drug, which is the cause for a large amount of illegal activity in Canada. Legalization allows the government to regulate the use and sale of marijuana, like such things as tobacco and alcohol. Results from public opinion polls conducted over the past 2 decades have revealed that an increasing majority of Canadians agree with the decriminalization or legalization of marijuana. Public support for legalization has been slowly garnering media attention, putting pressure on the legislators and the government to amend the outdated laws surrounding the drug's use. In November of 2015, Prime Minister Justin Trudeau publicly endorsed the legalization of the recreational use of marijuana and worked on the legal framework which introduced legislation in the spring of 2017.
With medical marijuana becoming legalized in Canada in 2001, the search to discover if marijuana offered medicinal properties became full tilt. In doing so, randomized control trials were implemented to compare marijuana to other traditional pharmaceuticals prescribed. Compounds found in the cannabis leaf, THC and CBD, have been used to medicate a variety of disorders ranging from pain relief, both musculature and neuropathic, seizure disorder reduction, and muscle spasticity relaxation. As of June 25, 2018, the FDA approved of an oral medication called Epidiolex, a substance that is derived from CBD, the primary non-psychoactive chemical component of the cannabis plant. Epidiolex is used to treat seizures associated with 2 rare and severe forms of epilepsy, Lennox-Gastaut syndrome and Dravet syndrome, in patients 2 years of age and older. 2 other pharmaceuticals, dronabinol and nabiloin, are both FDA-approved medications that aid in the management of a variety of ailments. Dronabinol is a man-made synthetic form of THC that acts mainly as an appetite stimulant, antiemetic, and sleep apnea reliever, normally prescribed to HIV/AIDS patients to stimulate appetite as well as treating nausea and chemotherapy patients. Nabiloin, another man-made cannabis supplement also using the active ingredient THC, is effective in treating severe nausea and vomiting caused by chemotherapy. THC is the main psychoactive component in the cannabis plant. Nabiloin is also prescribed when other antiemetics do not suffice. Nabiloin is also found to be effective in reducing spasticity-related pain in patients who struggle with upper motor neuron syndromes. In a randomized placebo-controlled trial, smoked cannabis was used along with a placebo cigarette to aid in neuropathic pain in patients with HIV. 50 patients completed the trial, resulting in 34% daily pain reduction. In comparison to the placebo, the first cannabis cigarette reduced chronic pain by a median of 72%, as opposed to 15% with the placebo. In 2013, it was estimated that medical marijuana saved Medicare about $165 million. If medical marijuana was legal nationally in the United States, since only a select few states legalized marijuana in 2013, Medicare Part D, the coverage responsible for prescription medication, would have declined by almost $500 million. Although that is only about 0.5% of the program's total spending, $103 billion, that is still no small fee that should be disregarded.
So, how will the legalization of marijuana affect Canada's future? Since the legalization of marijuana happened recently, there isn't enough data or studies that show significant impacts on society. However, since the United States legalized marijuana in multiple states before Canada, we will use their collected statistics on the legalization of marijuana as a predictive measure for the future of Canada. The 3 parameters that will be observed are the motor vehicle crash fatality rates, crime rates, and the access to youth. Firstly, with motor vehicle crash fatalities, multiple studies have shown an increase in fatality rates for drivers under the influence of cannabis. In fact, a recent study states that from 2011 to 2015, THC-positive patients were significantly less likely to wear a seatbelt or helmet. Also, since the legalization of cannabis, THC positivity among motor vehicle crash fatalities has tripled. With crime rates, a study in 2006 analyzed the association between state medical marijuana legalization and state crime rates for all Part 1 offenses collected by the FBI. As a result, they did not indicate a crime exacerbating effect. More recently, a study in 2017 had mixed results where Washington reached a year-low crime rate in 2014, but found an increase in cannabis-related crime in 2016. Lastly, with youth access, as a prediction, one can expect to anticipate an increase in youth cannabis use. However, in Washington, results have shown a decreased usage by students in all 4 grade levels of high school, dropping from 20% in 2010 to 17% in 2016. Will Canada expect to see an increase in motor vehicle crash fatality rates? Will Canada expect to see similar fluctuating crime rates? Will Canada see an increase in marijuana use in the youth? What do you think? From the perspective of an epidemiologist, do you support the legalization of marijuana?